All are doing great today. This is a great Wednesday. Weather looks really good today. Hey guys, today is a great topic. Again, it's about type 2 diabetes, which reflects on fatty liver disease and also high blood pressure. They all have something in common. It's your lifestyle. But what brought this particular topic on is in the last few weeks, I've gotten quite a few phone calls of people that have been diagnosed with type 2 diabetes. And either their friends have passed my information on to them, or they want to know more information through some of my posts that I have done on Facebook. But what I want to go over today, guys, is this is an issue that many doctors are doing right now, is they're actually prescribing type 2 diabetic medication like metformin or insulin resistance. And guys, that's okay, because a couple of these people that I talked to were diagnosed with type 2 diabetes. Their blood glucose levels were up in the 400s, and one of them, the AC1 was 10. The other one was at 14. And in an emergency like that, you need to get that blood glucose level dropped down fast. So So the doctors prescribed obviously metformin, which does help to drop it to a certain level, and also one got a combination of both metformin and insulin. But many of today's doctors also realize that the medication will never ever totally reverse type 2 diabetes. So what are the doctors doing? Yes, they're using the medication in an emergency situation, which is what they should do. But they also realize that they have to change their patient's lifestyle. And they have to go what actually works, and that's using a natural way of doing that. And so what I've done here, guys, is there's two programs that are actually what many of these doctors are using to help reverse type 2 diabetes. Now, I've been using these two programs for over 40 years and have helped many type 2 diabetics. I've reversed many people that have had fatty liver disease. And naturally, when you do all that, your high blood pressure is going to drop too. But science has been talking about this for decades, and it's finally getting into, or the doctors are finally realizing that the medication is never going to work. Matter of fact, the medication, both metformin and insulin, is going to actually have some severe side effects. And those of you that are on those and have been on them for a while, you need to go and investigate the side effects of metformin and insulin. Now, with metformin, one of the biggest side effects is kidney failures and liver failure. Insulin will cause you to gain weight, which is going to cause other medical cardiovascular issues. And so what I've done, guys, is I've found some really good scientific case studies that are actually showing the benefits of these two programs. So blood tests don't lie. And so one of the tools that we use in our online coaching program to help those with type 2 diabetes or fatty liver disease is we monitor their blood glucose levels and their ketone levels 3 times a week at certain times. So I have a documentation for the doctors. So we work with the doctors and we document the blood test to show the doctors that we are lowering their blood glucose levels by changing their lifestyle. Also, it gives the doctors a chance to start lowering the metformin piece by piece, or lowering the units of the insulin. And that's what our objective is to work closely with the doctors and do it naturally and getting them off the medication completely. So the first case study I have, I'll read it to you, was found, let me see. And so the two programs that we're talking about that we use in our online coaching are, number one, change the type of food you're eating. Number two, change the time you eat. So let's do change the types of food you're eating, and let's go with what is working the best today, and why most doctors are using this program, which is ketogenic meals. And only what ketogenic meals means is a high good dietary fat, moderate amount of a good source of protein, and low carbs. And all your carbs are going to be coming from organic vegetables during the time when you're trying to reverse your type 2 diabetes and get off the medication. So the first test I have, now again, blood tests do not lie, guys. And so that's why we document your blood glucose levels and your ketone levels. There was a research done, a scientific case study that was published by the National Library of Medicine by the Nutrition and Diabetes in 2020. And so what they did is they tested patients on a ketogenic lifestyle or ketogenic meals, and which is, I said, high good dietary fats, moderate amounts of proteins, and low carbs coming from your vegetables. What they saw was a significant decline in blood glucose levels, is what we're looking for, and their conclusion was the ketogenic meals not only has a therapeutic effect on blood glucose levels among the patients with type 2 diabetes, also significantly contributes to their weight loss. So, by changing your types of food you're eating to a ketogenic meals or a good dietary, high good dietary fat, low carb or moderate protein and low carb meals, mainly coming from veggies, it showed proof that it did help reverse type 2 diabetes. Now, the problem is I'm seeing that most people that start on this try to do it on their own, and they're not consistent, or maybe the ketogenic foods they're doing isn't quite working. So an experienced coach comes in handy, because he will then start looking for other types of food and customize your meal plan that best fits you, because we can do that because we're following your blood glucose level. So when your blood glucose level drops to below 100, then we know we're on the right track. And when your ketone levels are above 1.0, then we know we're on the right track. Now, what we do is we combine it with the next program, which is known as intermittent fasting. So we're going to change the time you're going to be eating. This research was published in the National Library of Medicine by the National Institute of Medicine. This is a pretty extensive research, because there was 1,422 participants that had type 2 diabetes, and they were put on a fasting protocol, different fasting protocols, 16-8, which means you have a 16 fasting time, 8-hour eating window, 18-6, 18 fasting time, no calories, 6-hour window, 20 and a 4, which means a 20-hour fasting, no calories for 20 hours, and you had a 4-hour window to eat. And then they're put on the 23-1, which is 23 hours of fasting and a 1-hour period of eating, which means the 23-1, you're only going to be eating one meal that day. So what did they find out? Okay, let's see what they said. So the results showed that this type of fasting is safe and well tolerated by all of them. Furthermore, it led to an enhancement of emotional and physical well-being, which means the fasting helped their mindset. A lot of people may have a cloudy mind, or whatever you want to call it, but it helped that as well. And improvement on an improvement on cardiovascular risk factors and subject health complaints. Fasting helped with weight loss and reduction of abdominal circumference. So, which means they lost body fat and their belly fat were reduced. We have been, blood pressure showed a significant decrease. We further found a decrease in blood lipid levels following the fasting periods, decreased bad LDL cholesterol, decreased in significantly all the groups. So all the groups saw a decrease in blood lipid levels, which is fat in the blood, triglycerides in the blood, and also help to decrease the bad LDL, which is all the groups saw that. But the biggest thing is, this is what we're going after, is the glucose levels and the A1C levels decreased significantly, which points out to a positive effect. This is right from the site. A positive effect of fasting on type 2 diabetes. So why have we been successful with our type 2 diabetic clients, or our fatty liver clients, or our high blood pressure clients over the years? The reason is because we've been combining these two programs for over 40 years with those clients. And the other thing is, we have the tool to monitor their blood glucose levels by documenting them for the doctors, and we're also keeping you guys accountable so you're consistent in seeing the results. So what's your next step? Next step is go to billmabrycoaching@gmail.com. You can ask me any questions, or if you like, we can go on a consultation call on the phone. Again, all you have to do is go to billmabrycoaching@gmail.com. Let's go over your whatever issue you have, and that includes cancer. And let's see if we can find the solution, which I know we can, because I have the blood test to prove it. Okay, guys? You guys have a great day, and we'll see you guys in the next video.